Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is an overview of RSD and CRPS. RSD stands for reflex sympathetic dystrophy, and CRPS is complex regional pain syndrome. Both are basically the same thing. They represent a chronic pain, neurologic syndrome that is very frustrating to both patients and doctors alike. The basic problem is that the patient has an overactivity of the sympathetic nervous system, resulting either from a trauma, surgery, or some unknown cause. In the early 90s, the International Association for the Study of Pain changed the name from RSD to CRPS to try and characterize the condition better. However, both terms are still in the public repertoire. How common is the problem? It's unclear what the total numbers are, but somewhere between 5 and 12 million Americans have RSD or CRPS. 75% of those afflicted are female, and it's unclear why it occurs. We know it involves overactivity of the autonomic nervous system, specifically the sympathetic part. The trigger is either, it could be surgery such as a knee scope or a total knee replacement, a trauma like a car accident, or even something minor. It just sparks up the autonomic nervous system. It just doesn't shut off. So the symptoms may be severe burning pain that is intense and much stronger than you would expect for the injury that was sustained or the surgery undertaken. The pain gets worse over time rather than better. Starts at the point of injury, but it can spread to encompass the whole leg or the arm. It may even spread to the other side. Patients often have significant sweating and swelling, extreme sensitivity over the affected area, maybe even just a sheet over the leg just causes intense pain. And in later stages, bone and skin changes. It also can lead to insomnia and emotional issues. There's 3 stages. Stage 1 is the first 3 months. Skin temperature changes, muscle spasms, severe burning pain, hair and nail growth faster than normal. And then you start to have some skin changes like blotchy, pale, shiny, sweaty skin. Stage 2 is 3 to 6 months. You start getting more skin changes. The nails start cracking. Pain gets worse, hair growth that slows down, and then you start to get some weak muscles and stiff joints because the person's not using it as much. Stage 3 is when the issue becomes irreversible. You start to get muscle wasting, entire arm or leg involvement, and limb contractions. So the treatment options, it's very hard to cure these conditions, but it can be slowed and reversed significantly. Physical therapy can be beneficial. Medications such as narcotics, antidepressants, blood pressure medications, anti-inflammatories, steroids, neuropathic medications, and calcitonin. A lot of these are just used off-label, for the condition that can maybe help. Interventional procedures, lumbar sympathetic or stellate ganglion nerve blocks. Here's a lumbar sympathetic block. Patient lays face down, IV sedation. Could be bilateral or just on the affected limb side. Needle goes around the spine and into the area where the sympathetic chain is. And numbing medicine, maybe steroid or phenol, is injected in that area. If that works well, then a surgical sympathectomy can be performed. As a last resort, a spinal cord stimulator or an intrathecal drug pump may be necessary to mask the symptoms of pain. What are the outcomes? Well, it depends on the timing. The earlier the treatment, the better. There's a large study years ago in the Journal of Bone and Joint Surgery that showed that if treatment is started within 2 years of onset, you can actually get 80% good to excellent results. Between 2 and 5 years, it goes down to 70% good to excellent. But if it's after 5 years, you're only looking at 10 to 20% effectiveness. In the Annals of Neurology, they looked at spinal cord stimulators for RSD in 54 patients. Very long-term favorable outcomes. There were minor complications. The newer ones that react to whether you're laying down or standing up are great. The older ones, there was an issue between laying down and standing up. Sometimes the patients would have jolts of pain because it didn't react well to changes in the positioning. Lumbar sympathetic block and stellate ganglion blocks is when anesthetic is injected into the ganglia of the stellate or lumbar sympathetic areas. Immediately the patient should get a warm feeling. That's when you know that it worked. Usually 2 degrees Celsius is what you see. Pain relief may occur within a half hour and last for days to weeks. May need 1 to 2 blocks per week with about 5 total to permanently relieve the symptoms, or may end up needing going on to an operative sympathectomy. RSD and CRPS are complicated because there's a lot that we don't know, and the people present with varied presentations. So combination individualized treatment is typically best and leads to the most successful outcomes. The overall goal is to break the cycle of the sympathetic overactivity and to reduce the ongoing pain. In Washington, the top pain management is through the Washington Pain Network. There's multiple clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rate is over 90% with the board-certified award-winning doctors. Visit us online today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.